Okay, everybody. So welcome to our webinar on Medicare. My name is Michael Canzoni. I'm a certified financial planner with Canter Wealth. Joining me today is Colleen McGlamery and Tracy Ron Call. They know more about Medicare than most. I might even call them Medicare experts. If you're like most folks, you probably find Medicare a little bit confusing. And if you're approaching the age of 65, your mailbox is probably being flooded with Medicare propaganda. So we're hoping to give you some good information. We're hoping to help you guys make informed decisions. I might say that it's important to not look at Medicare in a vacuum. It's important to understand how it fits into your tax strategy, your cash flows, your real estate, your investments, and your overall estate plan. We're going to try to get through the material and take questions at the end. You can submit a question through the chat feature at the bottom of your screen. The last time we did this webinar, it was really popular and we weren't able to get to all the questions in the allotted time within the hour. So you'll receive a seminar evaluation at the end, and on that evaluation, you'll be able to submit your questions in writing. And we'll try to follow up with you at some point. So, Colleen, Tracy, tell us about Medicare.
Thank you for the intro, Michael. Again, all of you, my name's Colleen McGlamery, and thanks to Canter Wealth for this partnership between myself and Tracy. Michael, you're absolutely correct in that we are the Medicare experts. We were just discussing with you the lovely certifications that we have to go through every single year, and that is so that we are up to date with the most up-to-date regulations concerning Medicare through CMS, or Center for Medicaid and Medicare Services, which we'll go through in this presentation. Just as a disclaimer, just like I said before, we take certifications every single year because this information is subject to change. So the presentation that you guys are all going to see today and be a part of is the most up-to-date information that you can find. We are your Medicare experts, as Michael said, and we're just really happy to be here and help get a grasp of what is Medicare. So with that, we'll begin. All right, so today, just our basics with this presentation. It's less than 30 slides, so it's going to be obtainable for you to grasp and to feel confident with by the end of it. Again, if you have questions, please put them in the chat, and we'll try and keep this interactive so everybody's paying attention the whole time. But we'll go through Medicare basics, meaning what's A, what's Part B, important terminology that you're going to see on any of your plan information, enrollment periods. Very important to know your enrollment periods so that you do not miss them. Plan types, any plan recommendation, so Medicare Advantage plan versus Medicare Supplement plan, and then some cost assistance programs. So an overview of this presentation, we'll start with Medicare Parts A and Part B. I'm sure everybody here has heard of them. They've gotten something in the mail about them. Maybe they don't know what they are, and that's why they're here today. We'll walk you through each of those in detail. Second piece is going to be original Medicare eligibility. So when I say original Medicare, that means specifically Parts A and Part B only. And who's eligible? Are you eligible for them yet? Or maybe were you eligible for them? Original Medicare costs. So what am I going to pay for this? What does this cost for me? How does it get deducted? And what's that going to look like? Applying for and enrolling into original Medicare. So Tracy and I can direct you on how to enroll into applying to original Medicare. Again, that's Part A and Part B. And then additional Medicare plan options. So again, Medicare Supplement versus Medicare Advantage plans. The more you know, the easier it's going to be for you to choose a plan that's right for you. Education is key, it's power, and that's what we're here to do, is be that educational piece so you know very clearly what you have for your health insurance and what's best for you. So what is Medicare? It's a federal health insurance program. It's run by CMS, or Centers for Medicare and Medicaid Services. You might have heard me a few minutes ago speaking about this. This is how we are governed. This is what we are regulated by. So just like financial planning, Canter Wealth, everything's very highly regulated. Same thing with this industry. And it's a part of the U.S. Department of Health and Human Services. So some important terms that you're going to see on every insurance plan, just stuff to know so that you're educated on this, is the differences in what's a premium, what's a deductible, co-pays versus co-insurance. So premiums, this is a price that you're going to pay. Typically, it's on a monthly basis. Deductible is the amount that you pay prior to the plan coverage. Co-pays are a fixed amount. Usually you pay them at the time of a doctor's visit. So you'll see, you know, any plan information, your co-pay, $5 for a doctor's visit, maybe $25 to see a specialist. That's a fixed amount. It's not going to change. Co-insurance, it's an agreed amount that you pay for a doctor's service. And this is typically a percentage of the total bill. So when I say co-insurance, normally in the Medicare world, this is a 20-80. Original Medicare will cover 80%. Individuals, beneficiaries, unless they're on a Part C plan, are going to have to pay that 20%.
That seems a little precarious to me. Would you agree? Having that almost makes the sort of upside limit unlimited, really.
Right, exactly. It's a vulnerable space to be in, simply having original Medicare, but it's a common misconception. You know, Tracy and I speak to clients all the time, and they say, yeah, I got my Part A and my Part B, I'm good, you know, and they want to hang up the phone. But this is, you know, why we're here, is to educate you on original Medicare is only going to cover you up to 80%. If you do not have a Part C plan, a Medicare supplement plan, you know, or a Medicare Advantage plan, you endure that 20% of however high that bill is. So it's a vulnerable place to be, and it's great too. It's a good question for you to have, just to clarify that. Okay, so this is kind of an intro into what I was just talking about. Original Medicare covers many, but not all healthcare related services. So this is basically stating it's going to cover you up to 80%. Again, you are responsible for the 20% that original Medicare does not cover. It does not include prescription drugs, hearing, dental, vision. So we'll get into the specifics of what does A on my card cover me for, what does B cover me for, and then what are my options to make sure I'm 100% covered. All right, so we're going to break down Part A. This is hospital insurance. If you have your original Medicare card already, it'll say right on there, Part A, hospital. So this is going to help cover your inpatient hospital stays, skilled nursing facility care, hospice care, home health care. And for most people, for most individuals, the premium is $0. You don't pay for Part A. And that is if you qualify by having worked 10 years or paid into Medicare state taxes, or 10 years, or what's also known as 40 quarters, if you've heard that terminology before. For those who don't qualify for that $0 premium, you may be able to buy in. However,
Well, and so to say that Part A is free is not totally true, because people are paying in as they work, right?
Oh, I am right now. We all have. Yeah, right?
Right.
You just don't have to pay for it once you turn 65. It's nice to see a $0 premium, right? You have definitely paid into it. I'm right there doing that as we speak. All right, so let's dive into Part B, medical insurance. You can think of this as everything outside of hospital, your doctor's visits, outpatient care, home health care, durable medical equipment. So examples of that would be like oxygen or a wheelchair, some preventative services, so vaccines, cancer screenings. What's the cost? How much is Part B going to cost me? If I get Part A for free, since I paid into it all these years and you worked 10 years in the United States, I get that for $0 premium. What's Part B going to cost? So that's based on an income, and it's determined again by Center for Medicare and Medicaid Services. So the standard premium in the state of California is $144.60. Okay, this is for individuals that are within that financial bracket. You make a certain amount of money a year, you're underneath a certain amount. The standard rate is $144.60 per month. And just like the slide says, you can have that taken directly from your Social Security check. So, you know, common misconceptions, you know, I've heard this before from clients. I'm turning 65. I thought I got Medicare health insurance for free now. So this is something that Tracy and I reiterate daily. There is a premium for Part B. Okay, so original Medicare eligibility. Qualifications for original Medicare are determined by the federal government. Again, highly regulated. So here's who qualifies. If you are age 65 or older, if you are under the age of 65 and you have been deemed disabled for 24 months or longer, if you have end-stage renal disease and you're in the 4th month of dialysis, if you have ALS and you're in the 1st month of diagnosis, you need to be a citizen of the United States or a legal resident for at least 5 consecutive years. So again, this is eligibility for original Medicare Parts A and Part B.
Before you move forward, one of the questions I get as a financial planner is the overlap, or what I might call the lack thereof overlap, in terms of Medicare and then long-term care. So can you comment on that before we move on?
Sure.
Yes, I'm gonna let Tracy take this question.
That's a very good question, and we get that a lot because people think that Medicare will cover their long-term care. One of the benefits that original Medicare covers is skilled nursing, and that's quite different than long-term care. Skilled nursing is more of a rehabilitation, and original Medicare will cover basically 20 days, and then after that, there's a copay for that, and then you only get 100 days per year. So and that's just with original Medicare. So it is not long-term care. So there is that misconception that Medicare will cover my long-term care. It absolutely does not.
And then who makes the decision whether the patient is being rehabilitated at that 100-day mark?
It's actually, it's between the doctor and the nursing facility, the skilled nursing facility. If they see that the patient is getting better, then they'll continue care. If they see that the patient has basically stopped, continuing to get better, then the skilled nursing facility will talk to the family and say, this might be more of a long-term situation, and would move them out of skilled nursing into more of a permanent housing or permanent nursing facility. So it's a collaboration between the doctors, nurses, family, but yeah, they have to be getting better. They won't just leave.
Thank you.
Okay, great question. Okay, so we'll move on to, how do I apply for original Medicare? And maybe some of you have already gone through this process, but for those of us that are coming off of an employer plan, just turning 65, these are your 3 ways of applying for Part A and Part B. And I do want to make a disclaimer, Tracy and I do not work for Social Security. So we are licensed Medicare specialists. However, we have the resources for you and the directions to point you in to get that first piece of getting you started with having your Medicare benefits, which are either one of these 3 options. So you can go to a local Social Security office. A way to locate one of those is through ssa.gov. Second option, you can apply online. If you are savvy with online enrollments, go right ahead, ssa.gov. Or the third way is to simply call Social Security. You can speak with an agent, and that number for you is provided. It's the 800-772-1213. I have that on speed dial. I give that number out to a lot of clients every day.
And which one of these options would you say is the most efficient in your experience?
Well, right now, I don't know of any Social Security offices that are open right now due to COVID. So really the only 2 options as of recently have been applying online or calling directly. And I personally, I suggest to my clients to call and speak with an agent over the phone, just to ensure that those applications go through, that you don't get confused with the online enrollment, miss a piece, and then a couple weeks goes by and you don't hear anything. I just think it's a safe bet to speak with somebody directly over the phone and get a confirmation that way.
And I might add, based on my experience, I've called the SSA many times. It's sometimes it's hard to get through, but it's been my experience that when I get someone on the phone, that person is fairly knowledgeable and oftentimes helpful.
Yeah. Oh, absolutely. I mean, just like this is our job, that's their job. That's their piece, is to be extremely knowledgeable on this enrollment and getting all the questions answered for individuals that are seeking to enroll into, again, A and B. And the numbers provided, the TTY 800 number, 3250778, is for individuals that are hard of hearing. So if you're not as computer savvy, but you do want to call someone on the phone and you're concerned about not being able to hear them well, there is an option, that TTY number. All right, so we'll move into enrollment periods. Again, I mentioned at the beginning of this, enrollment periods are so important to know. You can always, of course, direct your questions, reach out to myself or Tracy to make sure you know when is your enrollment period, what are the big enrollment periods coming throughout the year. But the most one that I talk to about clients that are turning 65 is your initial enrollment period, or you might hear IEP. So this is a 7-month window that allows you to apply and enroll into Medicare. It's 3 months before your birthday, the month of your birthday, and 3 months after. Again, this is for individuals enrolling into Medicare for the first time. 3 months before, the month of your 65th birthday, 3 months after. These graphs here, we try and keep it exciting with all the different colors. So as an example, if an individual's birthday is in April, you have 3 months before, so starting in January. Your coverage, however, does not begin until your birthday month. So if you have enrolled, you called the line, you enrolled into Part A and Part B, your effective date would be April 1st, 2020. If you enroll into your birthday, during your birthday month, that's the day of the month you choose to start after your birthday. And then once you get into May, June, July, if you enroll in May, your effective date will be for July, and so forth. Okay, so let's talk about individuals, this may or may not be you, that missed their enrollment period. If you didn't sign up for Parts A and B when you were first eligible, and you're not eligible for a special election period, or SEP, you can always enroll from January 1st to March 31st each year. I have a handful of clients that did not enroll when they needed to or were within their window, and January 1st, I have a list of people to call. So this does happen. However, that is why there is this enrollment period called the general enrollment period. Again, for individuals that missed their enrollment period for A and B. You will enroll through Social Security, January, February, March. You will pick a Medicare Advantage or a Medicare Supplement, April through June, and your effective date will be July 1st.
I think you might get into this a little further down the road here, but tell me when the penalties kick in. If I miss A or B and come my enrollment period and come January 1st, am I going to be subjected to a penalty?
Yes, there are penalties. The big enrollment penalty is Part B. So Part B late enrollment is 10% from your Social Security every year that you did not enroll into Part B. So that can be a hefty penalty. We're talking 20% if you go 2 years without Part B, not knowing it. 5 years, that's half of your Social Security that's coming out. Part D, as in David, so prescription drug, is a 1% of the national average. So it's not as intense. However, these are the penalties that you might have seen in some of the letters that you get from Social Security, things that you might have seen on, ads. These are the penalties that they're incurring about is Part B, the 10%, Part D, as in David, 1% of the national average. Okay, so special enrollment periods. Again, if you didn't sign up for Parts A and B when you were first eligible because of group coverage, you can enroll. So this happens so often. My dad is 67 years old. He did not enroll into Part B when he was eligible at 65 because he's still working. A lot of our clients are still working after 65. This might be some of you on this call tonight. And if you are on a group plan, this is basically stating that you have credible coverage. If you are coming off of your employer plan, if you are retiring, if you do some research and realize that you want to move on to Medicare and receive these benefits, and you don't want to be on your group employer plan anymore, that would give you what's called a special enrollment period. I know that this slide says during 8 months after employment or after group coverage ends, whichever is first. The number that Tracy and I really want to leave all of you with is 63 days. Enrolling into original Medicare and getting onto either a Medicare Advantage or Medicare Supplement plan within that 63 days, because that will ensure that you have a Part D plan. Do you have anything to add to that, Tracy?
No, that would be good. It's just really important that 63 days, because that's the time frame, whether it's Part D or Medicare Advantage, that includes that drug coverage. That's the ticking clock on that.
Mm-hmm.
For sure.
Yeah. All right, so additional Medicare options. Eligible persons can choose additional healthcare options to assist with extra benefits. This is your prescription drug costs and out-of-pocket expenses. This is where we get into Medicare Advantage versus Medicare Supplement. And these are your 3 options. So you've called Social Security, you've done your part, you have original Medicare Parts A and Part B. This top frame here with the red, white, and blue card, that might look familiar to some of you. Original Medicare, again, Part A is going to have hospital with an effective date. Original Medicare Part B, going to say medical, again, with an effective date. So your 3 options, number 1, you can have original Medicare, Parts A, hospital, Parts B, medical, again, 80% coverage, and you can add a prescription drug plan through a private insurer or buy up a prescription drug plan. Again, this leaves you with that 20% that you are not covered. Option number 2, original Medicare, Parts A and Part B, a Medicare supplement, plus a prescription drug plan. So the Medicare supplement helps with that 20% that original Medicare does not cover. And then prescription drug plan is, again, private insurer, you buy up a prescription drug plan to have your medications covered. Option number 3 is what's known as a Medicare Advantage plan. So this is what I call, it bundles everything together. You do have to have original Medicare, Part A and Part B, the red, white, and blue card with active dates for A and B, and you can buy up a Medicare Advantage plan. So this is going to include prescription drugs, vision, dental, hearing, and the 20% that is not covered by original Medicare.
So if I am choosing a Medicare Advantage plan, am I paying the Part B premiums?
Correct. That is correct. Yep. For all of these options, you are going to pay the Part B premium. The only way that you wouldn't pay for a Part B premium is if you qualified for low-income subsidies and the state was taking care of Part B for you. All right, so we'll go into Part D, prescription drugs. Federal government requires members to have minimal drug coverage. So this is something that I really want to drive home. I drive home to some of my clients. They say, I'm not taking any medications, I'm healthy, I don't plan on taking medications. And that's when I bring up the 1% penalty. Federal government requires members to have minimal drug coverage, okay? So prescription drug plans, they have specific lists of covered drugs. These are known as formularies. They are sold by private insurance companies. They can have a monthly premium, co-insurance, tiered copays, so meaning most plans tier 1 through 5. So tier 1, tier 2 are going to be more of your preferred generic prescriptions, and then anything lower in those 3, 4, 5 range are going to be more expensive prescription medications. There's 2 ways to obtain a Part D plan. You can enroll into a standalone prescription drug plan, just like those 2 examples on the slide before. You can either have original Medicare and enroll into a Part D plan, or you can have original Medicare, Medicare Supplement, and enroll into a Part D plan. Or option 2, you enroll into a Medicare Advantage plan, and that includes prescription drugs.
Okay, so Medicare supplement insurance. Over 14 million Americans are on Medicare supplement plans. They help cover the costs and services not covered by original Medicare. So again, this is helping the 20% that's not covered by original Medicare. Out-of-pocket costs can include co-pays, deductibles, co-insurance. The most common plan types that you're going to hear about are plans G, N, and F, but F is only available to people who turned 65 before January 1st of this year. So if you are brand new to Medicare, plan F will not be available to you.
I've seen that before on Part F. Why is that? Why are they precluding people, that group of people?
That's a great question, Tracy. I'll let you take this one.
Okay. So what happens with Plan F is that basically you pay a plan premium to a private insurance company to cover all of what original Medicare doesn't cover. So they put into a macro law back in a couple years ago, and as of this last year, January 1st, 2020, the top plan or the richest benefit plan is G, and there is some first dollar cost to the member now. There is a deductible, so there will be some money out of pocket to pay for a deductible on Plan G. So that basically there's a little bit now going toward that the member will have to pay first. So yeah, they decided to do that. They do make changes to these plans, especially on the Medicare supplements. We'll see plans close, we'll see plans change. And then also this enrollment with Plan F, we can't sell that anymore to those that are not 65 prior to January 1st, 2020. So that's a federal law.
Which is why it's so important for me to make the disclaimer at the beginning of this presentation.
Right.
This is an example of things that change.
Just when we understand it all, it's all going to change.
Yes. Right, yes. Then you can call us. Okay. Just some additional details for Medicare supplements. They're sold by private insurance companies. The premiums vary by state and by plan. They can require underwriting if you do miss your initial enrollment period. So be mindful of that. Often paired with original Medicare and a prescription drug plan. And again, you must be enrolled into both Medicare Parts A and Part B. That's really the golden ticket. Okay, so let's look at the differences. That was Medicare Supplement. This is our Medicare Advantage or Part C plan, which are increasingly popular. They're very comprehensive and low cost options. So again, covers A and B benefits. Most offer prescription drug coverage. Monthly premiums, some vary plan can be as low as $0 per month. They do have annual out-of-pocket maximums, which gives you that safeguard. So remember we were talking about, only having original Medicare Parts A and Part B can leave you in this vulnerable state where you're responsible for 20% of, any bill that comes your way. Having an annual out-of-pocket maximum, basically guarantees that there is a stop to, there's a number associated with your health coverage that's going to say you're not going to pay more than this maximum in a given year, no matter what happens to you or where you go or how many procedures you have. They have a network of doctors. So the network of doctors, meaning it acts more like an HMO. You'll have a referral from a primary to get you to that specialist. They are sold, again, also by private insurance companies. They're typically guaranteed issue, so no underwriting. They're not paired Medicare supplement plans or with prescription drug plans because they are together. So you've got everything kind of under one plan. And again, you must be enrolled in both Medicare A and B. That's our golden ticket to get you a Medicare supplement or a Medicare Advantage plan. Okay, so our enrollment periods. We discussed the initial enrollment period, the 7-month window to get you your Parts A and your Part B. Special enrollment periods, which is year-round if you meet the qualifications. There is a slide in here to go over, who's eligible for special enrollments. The annual election period. I'm sure some of you have seen ads on television. You've received marketing materials about it. For Medicare agents like myself and like Tracy, this is basically our tax season, okay? October 15th through December 7th. This is when you have your open window to change your Medicare plan. And then also the open enrollment period, January 1st through March 31st, can change Medicare Advantage plan to Medicare Advantage plan. And we'll go over these slides just so you're really clear on these enrollment periods. So again, IEP, your initial enrollment period. This is your 7-month window. You can enroll into a Medicare Advantage and prescription drug plans. You've got 3 months before your birthday, the month of your 65th birthday, and 3 months after. For Medicare supplement plans, your enrollment opens with the Part B effective date, okay? It closes 6 months later. After this period, underwriting is required, which can also leave you in a vulnerable state to be underwritten. Some special enrollment period qualifications. So members who qualify for an SEP or special enrollment period, they can change their Medicare and prescription drug plan at that time. So here are some common reasons that you would be enrolled into during a special enrollment period. If you've moved, so individuals that have moved out of your current coverage area, if you're in a new state or a new county, if you qualify for Medicare and Medicaid benefits, in California, we know that as Medi-Cal, so if you are Medi-Cal, if you've recently retired and you're coming off of a group employer plan, so I mentioned that a few slides back, this would open up a special enrollment period for you. And something to mention, COBRA, okay, COBRA and retiree health plans are not considered credible coverage. So why do you need to prove that you've had credible coverage? I mentioned to all of you, my dad's 67, he denied his Part B as in boy when he turned 65, which is okay to do. You want to stay on your employer plan, you can absolutely do that. However, when you come off of that employer plan, you have 63 days to get your original Medicare and enroll into a Medicare Advantage or Medicare supplement plan to get that Part D. COBRA is not coverage, okay? So it's not coverage that's going to be recognized as credible coverage to Social Security when they're doing your enrollment. So I've had individuals that have said, oh, my company is giving me 18 months of COBRA. My wife and I are going to stay on this. And I have to explain to them, well, you're going to use 18 months of COBRA, and then you're going to go enroll into Medicare, and the Social Security agent's going to ask you, have you been covered since you turned 65? Why didn't you go on to original Medicare or enroll? And if they say, well, I had COBRA, that's not going to count. That's not going to be qualified as credible coverage. If you're with a group employer, a work plan, that will make sure that you're covered, and usually your HR department is helpful with helping you fill out that paperwork that Social Security asks for.
I think that's really important information.
Yeah.
So I definitely have had people get caught in that trap, thinking that they were covered through COBRA, which they were, but when they sign up for Part B, they get hit with that penalty.
Exactly. And if you go a whole year saying I had this, I had COBRA for a year, that's 10% forever from your Social Security check. We don't want that, which is why it says it at the beginning of this presentation, education is everything. The fact that all of you are on this and educating yourselves, gaining more resources to ask these questions is going to ensure that you're not one of those people. And hopefully, if you have friends or family members that are in the same boat, same age range, retiring, you can relay this information, because we want the least amount of people enduring these penalties. Okay, the annual election period, October 15th through December 7th. Every year, Medicare beneficiaries can change their Medicare plans for the following year. So the enrollment period, again, October 15th through December 7th. The new plan effective date is always January 1st. So if you're not happy with your plan, if you signed up with one and didn't do the pre-education and looking at different plan comparisons in your county, a friend of yours is on a different plan that they love, you're not as happy or as satisfied, this would be the time to reach out to myself and Tracy and to work through that with you.
Can I go from a Medicare Advantage plan back to just Part A and B?
Yes, you can.
Okay.
An option.
I know that some of the decisions that we make with respect to Medicare are irrevocable, and some of them we can take back. So I just want to be clear that we can make that change if we want to.
Yes. All right, so our open enrollment period, or what we call OEP, January 1st through March 31st. If you are enrolled into a Medicare Advantage plan, you can switch to a different Medicare Advantage plan. You can also disenroll from a Medicare Advantage plan and switch back to original Medicare plus a prescription drug plan. So that's, you were kind of one slide ahead with your question, Michael, but there's your answer as well. Okay, so the last piece of this is cost assistance for premiums and Medi-Cal, kind of what those look like, extra help programs. So the last 4 slides are just discussing what those are and how they can help individuals. If it's not you, or if it is you, these are the resources, these are the websites to go to and how they can help you. So extra help, it's a federal program. It's tied to your Social Security. This only helps with prescription drug coverage. Okay, that's extra help. Your Medicare savings programs, there are 4 different savings programs and only some of them that help pay for Part B as in boy. So that 144.60 that we spoke about, this would be a Medicare savings program that could potentially help you. That's at benefits.gov. Your Medicaid, or again in California, we call this Medi-Cal. This helps with both medical and drug coverage, okay? So it coordinates with doctors that accept Medi-Cal. And the last piece is what we call PACE, or Programs for All-Inclusive Care for the Elderly. It's a county plan. It includes community caregiving. And basically you need to go to their clinics that provide in-home services for this program. And that's available on Medicare.gov. Medicaid or Medi-Cal, you will go to Medicaid.gov. And again, for extra help, SSA.gov. So kind of the closing piece of this presentation for, on behalf of myself and Tracy, there's a lot of factors to consider. You're choosing a plan, you're looking at your own budget. Who are your doctors that you want to stay with, that you've been with for years? What prescription medications are you on? How frequently are you visiting the doctor? What are your likes? What are your dislikes? Do you like to travel? These are things that we are going to tailor to you, the questions that we ask as Medicare specialists, so that we are able to locate and really divvy down the options that you have for Medicare Advantage and Medicare supplement plans in your county. There's a lot of them. We've got, in Southern California, up to 50 different Medicare Advantage plans, in some of our cities. So we don't expect you to be the experts. Really, this presentation is hopefully to get you to relax your shoulders and realize that we do all the certifications so that you don't have to. And you have your own Medicare specialist to call and reach out to walk you through, how do I get on original Medicare? And then once I have that Part A and Part B, what's the richest plan benefits for me in my area that has my doctors, that's in my budget. And that's what we help locate for you. We're insurance licensed agents, so we are authorized, we do the trainings, we take the certifications every year, and our services are completely free to you. So any assessments, helping you along the way from start to finish, that is no cost to you. So this can really save you time. It can also save you a lot of money working with specialists like ourselves to make sure that you're not getting any of those penalties and that you're on the richest plan benefits at the lowest cost. That's really the main goal. That's all we got.
Great. No, that's really awesome information. I've seen this presentation a few times, and I pick up something new every time. We've had a couple of questions come in. First question, does Medicare pay for gym memberships?
Ooh, good question. No, it does not. That would be a Medicare Advantage plan. Those come with the, you hear like silver sneakers, I'm assuming is what this client is discussing. So no, original Medicare Part A and Part B will not include free gym memberships.
Okay, great. Good information. And then we had another question come in. Can you briefly touch on the difference in annual enrollment period and original enrollment period again?
Of course. So IEP, or original enrollment period, is when you are brand new to Medicare. You're turning 65. 3 months before your 65th birthday, the month of, 3 months after. The annual enrollment period is for individuals that are already on original Medicare and have a Medicare Advantage plan or Medicare supplement, and they want to change the plan that they're on.
Great, thank you.
Yeah.
Okay, so I don't see any more questions in the queue, which means that we either have a really, really smart group or people are embarrassed to ask or try to ask questions. Actually, we have one that came in. I will be 65 years old. I will be 65 years old November 15th of this year. I will call Medicare on August 1st. Correct to sign for Part A and deny Part B. I am still working and hope to do so until 69 and a half, then 63 days prior.
Perfect.
Perfect.
Okay. Like I told you, we've got a smart group here.
Yeah, I'm
That's
impressed.
perfect.
I'm impressed. And, you know, the only thing that I would add on to that is, you know, just we can always look at the differences too between what your employer plan is offering versus what it might look like for you if you do want to turn on your Medicare benefits and enroll into a Medicare Advantage or a Medicare supplement plan. Medicare Advantage, Medicare supplement plans are simply going to offer more to you as a senior that's been paying into these policies, you know, their whole lives. So you're going to have more benefits through Medicare, more bells and whistles, as Tracy and I like to say, than staying on an employer plan. And again, you know, we're here to help look at those cost differences for you too.
So says, I'm not sure if you can answer this, but I retired from the school district, which pays for my medical insurance as well as my husband's until I'm 65. I will be 65 this December. However, my husband is younger and will only be 63 years old. Can I cover him on Medicare as well? So the answer to that is actually no. You'll be able to go on to Medicare because you're turning 65. If you decide to come off your employer plan or the school district plan, he will need to get an individual plan to cover him until he turns 65, or you can stay on the school district plan. We'd have to verify, you know, basically verify, go through the benefits, see what the cost is. You know, it also, with school districts, it really depends on how long your service is, because your service might be different than somebody versus 30 years of service, 20 years of service, or 10 years of service. So we would be happy to definitely compare what's available to you through the school district for yourself and your husband, and then also look at Medicare options as well.
Okay, guys, I don't see any more questions in queue. I'm going to go ahead and shut it down. Thank you, everybody. We hope that you found it useful. Again, our goal was to empower you guys to make great decisions. Thank you, Colleen. Thank you, Tracy. You guys are a tremendous resource, and we look forward to hearing more from you in the future.
Yes, thank you, Canter Wealth. We really appreciate this. Thank you, everybody, for joining.
Thanks, guys.